Welcome to the 12th episode of Homeopathic Stars of Nagpur. Today with Dr. Ajay Kale sir. Dr. Ajay Kale sir has been practicing homeopathy in Nagpur at his clinic Vishwashanti Homeopathic and Research Center in the heart of the city, and since more than 27 years. He has a vast experience of treating complex pathology cases with homeopathy. He believes in that sympathy is the best pathy. So, with his quick and gentle results, he has benefited n number of patients with complex pathologies like autoimmune disorders, cancer cases, endocrine disorders, lifestyle disorders, pediatric cases, and whatnot. Today, I am here to gain some of the valuable and knowledgeable insights with Dr. Ajay Kale sir that will benefit all the budding homeopaths like us. So, I welcome Dr. Ajay Kale sir on Homeopathic Stars of Nagpur. So, welcome, sir, on Homeopathic Stars of Nagpur.
Thank you.
Sir, so how will you introduce homeopathy to all the viewers?
Homeopathy is a science where everything is individualized. Homeopathy is a very vast science. It is a complex science. It is art of medicine which gives us individualization. We treat disease as a whole, person as a whole, and individualize each and every symptom so that we can give a particular result which is cure, which will lead to cure. As per WHO, homeopathy is the second largest pathy in the world,
Yes.
which is practiced worldwide.
Yes.
80 countries in the world are using homeopathy standalone or with integration with other practice of medicines.
Yes.
And 300 million peoples all around the globe are using homeopathy as a second choice of medicine. So homeopathy is nowadays is very useful and is very popular not only in India, it's also popular all over the world.
सर आपने बहुत अच्छा इंट्रोडक्शन बताया होम्योपैथी के लिए सर बट आपका मेथड व्हाट इज योर मेथड ऑफ प्रैक्टिसिंग होम्योपैथी
I practice homeopathy since last 30 years. So I have evolved my practice. First I used to practice on symptoms basis as what is taught in homeopathy. Then I tried different types of practices. As a practitioner, I started to learn all the clinical things because in 1994 when I started practice, we were not having that clinical knowledge. So I joined various private hospitals as an RMO, and then we tried to learn different emergencies, tried to learn different pathologies, tried to learn some skills, how to treat patient, how to manage patient, and this way I tried to develop my practice and I practice clinical homeopathy. Now what is clinical homeopathy? In clinical homeopathy we try to diagnose the patient. We treat patient as a whole. Suppose a patient of malaria is coming, he is having some common symptoms like fever with chills. So we try to examine the patient, see his symptoms, his signs, his temperature, BP, his diagnostic values also. We also investigate his blood. All the diagnostic tools we are having, we try to use it and we come to a diagnosis. So when we come to a diagnosis, we understand that these are the common symptoms. Now to treat him homeopathically, what we do, we see the uncommon peculiar symptoms and according to that we give medicines. Especially we use specific remedies for specific diseases. In 2005, there was a sad news. My mother suffered from brain tumor. We went to Mumbai also. We saw all allopathic type of treatment, surgical type of treatment. But brain tumor, what we call as glioblastoma, is such a malignant tumor that it multiplies very fast and no treatment is available now. So she succumbed to her illness in 1 year. That frustrated me that as being a doctor I could not do something for her, and in a search for that I found Dr. Banerjee protocol. Now Dr. Banerjee protocol has proven himself and treated glioblastoma patients, brain tumor patients with Ruta 6 and Calcarea Fos. That what attracted me. And then I went to Calcutta, visited several times, stayed there, leaving my OPD. I learned from him how to treat such severe patients of brain tumors, then cancers. There are a lot of patients they have been treated They have scientifically proven that these patients have been cured by them. They have all the documentation which is required for the scientific and research society. So in that way, my whole treatment changed after Banerjee protocol, and we shifted to evidence-based medicine, clinical medicine, and in that way we try to diagnose the patient first and then treat accordingly.
So, can you share your journey as a successful homeopathic practitioner? Like when the initial days of your practice, when there were no patients, or where you saw many failure in treating diseases with homeopathy. So, how did you struggle with those tough times?
As a homeopath, when I started practicing in 1994, people used to call us doctors of sweet pills. Homeopathic doctors were not recognized by the society. But because of my passion about homeopathy, I also got RMO-ship in different hospitals, tried to learn allopathy also. Most of my friends uh, went to villages and outskirts and started their practice, which was very easy for me also. But I tried in a difficult way, and I became passionate about homeopathy. And one time I used to do homeopathic practice, and the other time I used to do RMO-ship. My first RMO payment was 800 rupees at that time, and I used to charge 20 to 40 rupees consultation for homeopathic patients. And in this way, my journey started. So to manage economics, I used to do one time OPD and one time clinical practice, and then I shifted to whole time OPD. And with confidence and with my skills, I always try to develop my practice. I have visited ऑल द स्टालवर्ड्स, जितने भी बड़े होम्योपैथ है इंडिया में, सबको मैंने जाके विजिट करके हाउ दे प्रैक्टिस, व्हाट इज़ देयर मोडस ऑपरेंडी, आई ट्राई टू लर्न फ्रॉम देम. जो बताए उन्होंने वो भी सीखा, जो नहीं बताया ऑब्जर्वरशिप करके भी आई अंडरस्टूड दैट कि दिस टाइप ऑफ प्रैक्टिस. तो इंडिया में तो जो जो बड़े बड़े डॉक्टर हैं उनको मैंने छोड़ा नहीं कि वाह इनसे अपने को क्या सीखने को मिल सकता है. एंड दैट वे आई ट्राई टू डेवलप. देन आई ट्राई टू स्टडी रिसर्च पेपर्स, and according to research papers I also try to improve my practice. Then I introduce mother tincture practice. Then I introduce potency practice, because some scientific research says that after 12 ch there is no medicine. So I develop practicing with less potency, less than 12 ch also. Those who have done tremendous research, I have taken good things from them. I try to develop that. Most of the time I try to develop from Banerjee protocols also, and in this way I try to analyze myself. Then the difference came when I did my CCMP, Certified Course in Modern Pharmacology, in 2018, where I get a chance to study in GMC Nagpur. I visited GMC skin departments where I explore skin diseases. So in skin I live leprosy. I didn't treat leprosy. I didn't treat patients those are having infections, but I try to treat patients those who are having autoimmune skin disorders like lichen planus, psoriasis, then allergic skin problems. In this way always I was choosy in which patients we should choose for a homeopath. And that in 2018, after doing CCMP, it gave a boost to my confidence also. In my full experience of 30 years, I have tried to cure many patients or give them good results in liver failure, kidney diseases, and all other chronic skin conditions, viral diseases. And there are more popular treatments in homeopathy like renal stones, renal calculi, gallstones, and I tried all my level best to treat them accordingly.
So what is your thinking on following a brand or different schools of homeopathy? Nowadays there are different schools of homeopathy. Some are following mind method, some are following sensation method, classical method. So which method do you find promising in your clinic?
I believe in only my evidence and clinical based practice, because homeopathy is a difficult science to treat. It is already a complex one for a beginner. And if you add a different school of thought, with due respect to all the different school of thoughts, I myself don't believe in taking this type of treatment and making it more complex like mind method, sensation method, or any other type of thoughts that make it more complex. If you get a symptom of mind, you will appreciate that symptom in another way, I will appreciate in another way, and many other students will appreciate in another way. So it is very difficult to follow a single path in mind or any other sensation type of medicine or any classical type of medicine or using placebo. We are having 6,000 medicines in homeopathy, and as of practicing since 30 years, I have not touched even the more than 2,000 medicines. So I don't give placebo. I believe in giving medicine, because patient have come here to take medicine. He want cure, because I literally emotionally think that he should get cured, or I should give him a good advice. So I always try to develop myself and also tell somebody to you develop yourself. You believe in yourself, you develop your practice as a clinical practice. You diagnose the patient, you give them medicine, and then you evaluate according to you. You will have some experience in in 4 to 5 years. Then according to your experience, you can give medicines. Like for warts we give thuja. So there are some specific diseases, specific remedies. Somebody is doing different school of thoughts. They are giving some type of medicine, and the student who have passed just his graduation is confused what to do now.
Yes.
And what happens in the same difficult treatment, he get complex advices, which is not multiplicable. Clinical background or clinical symptoms are common everywhere. Diseases are common, which are in textbook also. This is multiplicable. But somebody is doing other type of practice, it's not multiplicable to you. अगर आप नागपुर में सक्करदरा में प्रैक्टिस कर रहे हो और वेस्ट में प्रैक्टिस कर रहे हो तो इट डिफरेंट. अगर आप होम्योपैथी कलकत्ता में करोगे तो देर आर 1,000 पीपल स्टैंडिंग इन द ओपीडी. दिस इज द प्रैक्टिस ऑफ होम्योपैथी इन कलकत्ता. सो हर जगह के हिसाब से प्रैक्टिस अलग होती है. तो यू हैव टू डिसाइड वेयर यू आर सिटिंग, व्हाट योर पेशेंट इज नीडिंग, और आपके पेशेंट को क्या आपको देना पड़ेगा, उसका इकोनॉमिक स्टेटस, उसका सोशल स्टेटस, और उसको आपको ट्रीटमेंट देने के बाद में आप उससे क्या एक्सपेक्टेशन करते हो. सो दैट बिकम सी. अगर आप बम्बई में प्रैक्टिस करते हो एंड यू आर ट्राइंग टू डेवलप माइंड सिम्टम्स, देन इट्स ओके. दे आर एजुकेटेड पीपल, they know what are mind symptoms and they can give you some good symptoms also to prescribe, but it's not practically applicable to each and every person or each and every doctor having the different IQs. So what I believe, that clinical practice is best, evidence based practice is best. You should research for yourself, develop some protocols and try to give medicine.
So can you share some of the examples from your OPD, your clinic, with some complex disorders where homeopathy has benefited many patients of complex disorders?
So I have treated many patients with different modalities. A lady came to my clinic very anxious, having panic attacks, severe headache, and she was diagnosed as a case of vascular headache, one-sided headache, migraine.
Okay.
She tried all the types of medicine. She visited in all over India, all neurologists and all other. She came to me, and I thought that this is a patient of migraine. So I gave her belladonna, and with all my advices, all her case taking and advices, within 3 to 4 months her headache got recovered. Her panic attacks were, she used to take allopathic medicines, such a huge doses that she was sleeping for 3 to 4 days. She was taking medicine and sleeping like a druggist. This is what she told me. And on that basis, when I give her this medicine, belladonna Q particularly, and I have treated many patients of migraine with belladonna mother tincture. It's a wonderful results we are giving with migraine. One more patient is of liver cirrhosis.
Okay.
This is a patient of alcoholic liver cirrhosis.
Yes.
See, there are cirrhosis many types. The hepatitis B also causes cirrhosis of liver, and any other, there are n number of causes of causing cirrhosis of liver. But what I have treated was alcoholic liver cirrhosis. He was a patient who had a bilirubin of 8 grams. Then he had ascites, he had portal hypertension, and he was told by all the doctors, specialists, that you have to transplant your liver. So he didn't get a donor. We get a span of 3 to 6 months. And he came to me that, do you have some medicine? And that time I was attached to Banerjee protocol, and I followed that Banerjee protocol. We gave him medicines, and with that medicines we saved him from liver transplant, and his 8 bilirubin came to 1. We had documented the patient in National Journal of Homeopathy also, and that was a wonderful patient what I have treated up till now. With this type of practice, I treated many patients of skin disease also, venereal warts, verruca vulgaris, then molluscum. This patient I treat very confidently and give them good results. Viral infections. These are patients of homeopathy. I try to choose patients which are very useful and which give good results in homeopathy. Then patients of skin disorders like lichen planus, psoriasis, chronic eczema. These are well treated by homeopathy. So in Corona, we treated number of patients, n number of patients with homeopathy and with integration with other medicines also. In chikungunya also I have helped many patients. In dengue, low platelet counts, we had good results in homeopathy. In this way, I always try to innovate, research, and to know some things that I can help my patient to get better.
Sir, so what qualities do you think that a homeopath must have to be successful in their homeopathic practice?
Now, in homeopathy, the homeopathic doctor should be skilled in clinical. He should know the clinical signs and symptoms of the disease. He should try to understand the disease. He should understand how to diagnose the disease. And I have developed an idea of examining each and every patient by taking pulse, BP, temperature, sign and symptoms, having all the symptoms recorded, doing all investigation, try to investigate thoroughly, having health checkups so that we know the complications of the patient. Suppose an elderly patient is coming for weakness. I have done blood sugar. His blood sugar was high. So he was suffering from diabetes, but he came with a different. So in homeopathy also we should have a knowledge of all the diseases. We should have all the diagnostic skills to diagnose a patient. In that way we can help the patient also. Yeah, every homeopath should develop clinical skills, diagnose the patient, treat the patient accordingly. This is what is we call as the clinical homeopathy. Also, a homeopath should know what is the scope of homeopathy. Now, if we take 100%, 20% patients are infectious diseases. Infectious diseases like leprosy, tuberculosis, we are not supposed to treat. So, this patient we have to exclude from our practice. Then other 80% patients are treatable by homeopathy, like 20% viral diseases. We can help them. Then other 60% people, they are lifestyle disorders. We can also help them. So in this way, we should know what is the scope, what is the limitation of homeopathy, where we should treat confidently and where we should not treat, or we should take help of other practitioners.
सर, जैसे अभी आपने बहुत क्लिनिकल नॉलेज के बारे में बताया, स्कोप एंड लिमिटेशंस ऑफ होम्योपैथी के बारे में डिस्कस किए सर, तो व्हाट इज़ द स्कोप ऑफ एंड फ्यूचर ऑफ होम्योपैथी इन इंडिया और ग्लोबली? व्हाट इज़ द फ्यूचर ऑफ होम्योपैथी अकॉर्डिंग टू यू?
This is a very good question you have asked. The homeopathic future is very bright because homeopathic future lies in integration. Homeopathic future lies in research and development. Now, with integration, you can integrate homeopathy with all other practices like allopathy, Ayurveda, yoga, naturopathy, and diet and nutrition. With all these approaches, you can have a good patient relation. Then you can improve patient symptoms. You can help patient and cure many diseases. This is now developing science which needs integration so that all the homeopaths and all other type of complementary medicines should come together, have some research and development, and work together to help for the betterment of human beings. Integration will improve patient satisfaction. Then this is also cost effective treatment. So integration is the future of homeopathy because from 200 years we are lagging in research and development, and now the era have come where the government of India and CCRH and Central Council of Research in Homeopathy is promoting programs
Sir, so as we approach to the end of this session, sir, what message you would like to give to the viewers or the homeopaths who are starting their practice as a homeopathic consultant?
To conclude this, my message is practice makes man perfect. So in general practice, we also have to do all the clinical signs and symptoms. We have to diagnose, be passionate what you are doing, try to learn, try to research, try to analyze each and every case, analyze and practice. This is what my message to you. This is what a homeopath should do, and what a homeopath should not do. It's a very good message. What I want to suggest that all the homeopaths should not stop medicines which are anti-thyroid medicines, anti-tubercular medicines, anti-leprosy medicines. We should give them medicines with their own treating medicine. Don't stop these medicines. Suppose a patient of autoimmune disorder is on steroid. If you stop the medicine, he will flare up. He will not come to homeopathy. He will blame homeopathy. So, as a homeopath, we should try that patient should not blame homeopathy because of our fault. So, in this patient, what don'ts are also important, do's are so important. So, don't do this type of practice where you stop all other treatment and try to indulge your treatment only. So, you try to analyze each and every case and try to practice this. Then don't hesitate to take expert advice, don't hesitate to take expert opinion. And lastly, I would like to say practice and analyze. Thank you.
So thank you so much, sir. आपका ये सेशन बहुत ज़्यादा इंटरेस्टिंग और नॉलेजेबल था.
Thank you.
बहुत अच्छा लगा कि आपने डूज ऑफ होम्योपैथ्स तो बताया ही, बट डोंट्स ऑफ होम्योपैथी इज़ ऑल्सो इम्पॉर्टेंट, जो बहुत सारे डॉक्टर्स नहीं बताते हैं. एंड ऑनेस्टली सर, आपने अपना मेथड ऑफ प्रैक्टिस बहुत ऑनेस्टली ये प्लेटफॉर्म पे शेयर किया. आई एम वेरी ग्रेटफुल टू इट सर. थैंक यू सो मच.
Thank you.